Thanks, Eric.
Hey, everybody. This is Eric Mishi, SAVE Executive Director, and welcome back. All week this week, we've been having incredible conversations with folks that have been helping us kind of highlight the work of those folks who are involved in suicide prevention, folks that are involved in discussions about how do we support mental health, all as a part of Suicide Prevention Week here at SAVE, Suicide Prevention Month, which is an opportunity for us to chat with folks that are involved locally on a state level and a national level, all working together to try to do what we can to help save more lives for suicide prevention. Just got done talking with Bob and Lynn Poferl, Run with the Herd. Great family, has worked hard as suicide loss survivors to turn grief into hope, into meaning. Earlier today, we chatted with Verno Mickelson with the Minnesota Department of Health, talking about 988 Lifeline and the work that they're doing in tribal nations. So a lot of conversations, a lot of folks talking about a lot of things that matter to the work that we're all doing in the area of suicide prevention. And I'm delighted to have this next conversation with Brett Smith, who is the safety director for Gardner Builders. As many of you know from the conversation that we had with Jonathan Oppenheim earlier this week with WTW, the construction industry is a particularly challenging occupation for suicide. And delighted to have Brett with us to kind of talk a little bit about the work that he and his colleagues have been doing to address some of those challenges. Brett, thanks for being with us today.
Yeah, thank you, Eric. First of all, I do thank you for the opportunity to participate in this event. It's an honor.
Well, it is a privilege for us to be able to. We've had a number of conversations with you, and I know that our director of programs, Jen Owens, has been fascinated by the work that you're doing and very supportive of it, and particularly given the industry that you're in and the high risk factors that are involved with it. So share with folks a little bit about your background and what do you do as the safety director at Gardner?
Sure, thank you. Yeah, about me, from manufacturing to construction, I have about 17 years experience in safety. The majority of that having been in construction through my tenure now with Gardner for nearly 5 years as safety director. It's been a privilege serving in that role, being given opportunity to really be a part of a commercial building firm based here in Minneapolis, but with offices in Duluth, Milwaukee, and projects in Chicago, which puts us in a position where we're fortunate to partner with men and women from very diverse backgrounds and experiences, which has really elevated our mission to change the construction industry in a way that has become adoptive of this mental health crisis in construction. It sounds like you guys have talked about it a little bit, I'm sure you have, but the rate of death by suicide in the construction industry is 5.5 times the rate of all other construction-related fatalities on the job site, and many times more than any other industry. You never know someone's full story without being present in the moment. So this matters in a big way. Though a story for another day, my lived experience is such that at only 20 years of age, I was dangerously close to having been a statistic myself. That's something that certainly fuels my passion for this topic. And, though we frame it through this corporate lens as a company and trying to truly make a difference, it matters to me an awful lot, being a part of it and being able to speak truth on a topic that, I think is wildly misunderstood or altogether unknown to many.
So while it's true that we've obviously talked about this, about the construction industry and what it's, and the fact that it, as an industry and an occupation is incredibly high risk. But let's kind of revisit what some of those reasons are, right? What are, we had a conversation earlier today with an individual who's a rural mental health specialist, right? If you look at suicide rates in rural communities today, particularly with farmers, right? they are at a public health crisis level that we haven't seen in decades. And there's a lot of factors around that. And there's clear factors around why construction industry in particular has such a high rate of suicide. So maybe share with folks kind of your experience in that space, and share with them why it is that this particular occupation and profession is such a high risk population for suicide.
Yeah, and I appreciate you asking that question so we can discuss it. It's interesting. A lot of occupations are stressful. Perhaps most are, depending on the nature of that occupation. Construction, particularly, is such that the stress is really induced by way of schedule, a fairly laborious nature in the work that we do. Really, in a way, despite your role, it's taxing, whether mentally or physically. Depending on where you are within the world of construction, you often find yourself traveling or working long, irregular hours, shift work in a lot of respects. It's taxing too, I think. It's made up primarily of men, at least historically, and so I find that interesting, in that women in the industry, have certainly made for themselves a way that is 100% akin to where we are in the industry. Every bit our equal, and so too is the stress. And so while statistics may suggest, it affects men differently than it does women, it's interesting to note that we find ourselves in that together. We often in the industry will talk about sort of the macho nature of who we are as men, typically, is where that discussion goes in a traditional sense. And that just applies to construction. So I like to take it out of that singular view or purview, and just look at it for who we are. We are very dedicated to the job as construction workers, sacrificing a lot for the greater good, and often at the expense of our own mental health and well-being. Not wanting to appear weak, wanting to be strong for others. Vulnerability is a really special thing that here at Gardner we take seriously, and in a way pride ourselves on. But vulnerability is a hard thing to come by, and it's a hard thing to convince others to really take on and wear in a way that they might be proud of that.
Yeah, and you've hit on a number of those factors that contribute to that, right? I mean, it's physical work, and if you get injured on the job, oftentimes we find folks self-medicating, trying to treat that injury, right? There's also the isolation that comes with that, right? You're dealing with that, and so all of these factors, contribute to what is already a complex subject matter space of suicide. And again, if you look at the parallels with farmers who are dealing, often a male-dominated industry, we're talking about emotions and feelings are not something that is culturally easy to come by for a lot of folks. You also have a culture of easy access to firearms and lethal means, particularly in an agricultural environment and setting. And so I think it's important for folks that are not in the construction industry or the associated industry to really understand what those unique issues are that make this a really difficult issue in trying to combat those factors that are contributing to those high rates of suicide. I mean, the numbers, I believe it was NBC did a story within the last 6 months where they highlighted it's just epidemic, the number of individuals who are dying by suicide in the construction industry.
Yeah, very true. And our goal really is to kind of flip the script in a way as we look at this mental health crisis, specifically suicide in construction. Gardner Builders is a co-founder, along with many others, of the Minnesota Construction Coalition, focused on suicide prevention and mental health and construction. Safety through the traditional lens has always been about observable behaviors and conditions. Our goal is to respect and in many ways carry that tradition forward, though we do so today in a way that humanizes the experience. I think that's what has largely been missing within this equation. It's about schedule and production and whatever numbers are represented within those factors, and we don't often take the time to pause and truly humanize the experience of it, because that requires time to pause and truly, again, be present in the moment. If we're meant to study and respond to individuals' behavior, as we are, as it has been the traditional way of doing business through safety and remains so today, we have to understand who we're talking to. Always more than meets the eye, right? So our mental health informs how we show up. It's who we are socially, emotionally, cognitively, and physically. And we've talked about that physical component, as is true for safety, where we put in place safeguards and preventative measures. It's all the more crucial that we work to protect and build up the whole person within this sphere. That means we have to create a psychologically safe workplace, intentional in the way we interact and authentic in the way we respond.
So with that, so let's talk specifically about Gardner and the work that you've all been doing there. And before we get to that, as a company, why does this matter to you at all?
Yeah. So it's interesting, right? I have lived experience. The lived experience in my case is me. It's not me having been affected by someone else. It's me, and I live with that, and I carry that forward with me and who I am today, and who I've been every day since. And while now today, looking back, I can say I'm somehow better for it. It's still very real and it's very raw, and so it means a lot to me. So within Gardner, there are individuals who, like me, have those same sorts of experiences, whether firsthand or secondhand, but so that it means something. I think the difference for us is we say of ourselves we're a hospitality company in the commercial building business.
Mm-hmm.
So if we're truly meant to be a hospitality company, no matter how we may define that, if we can't extend hospitality to the degree that, or by which, we are truly reaching the individuals who work for us and with us, then we're failing ourselves first before we can be of service to others. And so it matters to us in that way that we show up big in a way that we're true to who we say we are. And all the while, mental health begins to take on connotations and complexions different than what we first understood. And while it remains hard, difficult, raw, as I said, and sometimes opens up old wounds,
Mm-hmm.
it's purposeful, it's meaningful. It gives us a different sense of hunger in the work that we do and put forward.
So there's 10 years ago, these kind of conversations wouldn't take place in most companies in terms of we really got to make this investment. I mean, most of the conversations that always took place were about physical health, right? Yeah. We've got to make sure that people are physically healthy. We've got to make sure they take care of their bodies, and that, particularly in an industry where frontline workers are physically, putting themselves physically in front of whatever project they're working on. So as you look at this, why does the mental health piece of this thing now have that same level of standing as the physical health piece of this?
Yeah, that's a great question. 10 years ago, I look at myself and in construction, physically fit, strong, able-bodied, but perhaps a complete train wreck, right? 10 years ago, I was on the road a lot, on my own, left to my own devices, a family at home, and feeling that I was doing the right thing by sacrificing, supporting them, Fast forward then 10 years, family is intact and healthy. And in fact, this month, celebrating my 25-year wedding anniversary. Some of it hard to come by, and I would look at myself in the mirror and say that's you, that's me, that created a lot of hardship throughout that time, which means my wife is an amazing woman. But if mental health doesn't matter, then what's it all for? It's all going to be worth something, and there's got to be a redeeming quality in it all. And so I think that means every bit the opportunity we have here to step into it, show up big, and truly do our part to positively impact this industry. We say we're on a mission to change the construction industry. We mean that in a lot of ways, but we mean that today in the mental health space because we know we can. Maybe 10 years ago, we didn't understand that we had the power and capacity to do that.
Yeah. Well, and so Gardner kind of came to our attention from a story that we had read about work that you were doing specifically on a pod concept. Yeah. And while I know that doesn't inform the entirety of the body of your work, share with people what that concept is, what it was, and then kind of how does that fit into your overall focus on mental health and suicide prevention?
Yeah, thank you for asking that. The wellness pod started out really as a sort of conceptual thing, so that then we were able to produce a prototype and essentially install that on the job site just to get folks talking. The wellness pod and intentionally purposed spaces throughout our job sites are simply one way Gardner strives to accommodate the needs of our workforce, whether it's for the sake of privacy, speaking to these wellness pods and spaces, privacy for the sake of making a call to your doctor or your child's school, or the opportunity to take a mental health break, or for the purposes of a nursing mother who's having to work. All these ideas and these possibilities really are the genesis of the wellness pod, maybe with a focus first on nursing mothers. Having been born of a conversation with who at the time was one of our laborers, today is actually our field safety specialist here in the Twin Cities, having commented on how it was for her 20 years ago, having to pump in a biffy and really deplorable conditions. So, in that moment, we knew we could do better. So that really was sort of the germ that has sort of manifested from there. It's a way where we can contribute really to the cause in an intentional way to better the workplace as a whole. A lovely experience, because while we thought it might be for nursing mothers, we have men in all kinds, all walks of life, who are using it all for their own reasons, all very good reasons. And so it's really been a sort of revelation beyond our wildest dreams in that respect.
So talk a little bit about, kind of describe these pods. So I'm putting a link up here from an article that was, I think it's a publicly accessible link, but kind of describe these pods. So you kind of the initial iteration of them. Yeah. Talk about what they look like, how did somebody access them, how did somebody use them, and then let's kind of talk about kind of the what's next for you guys.
Sure. Yeah. So the wellness pod in its original design was a physical structure that is mobile, so that it would be transported from one job site to another. In doing it that way, it was maybe in a sense cost prohibitive, just given the raw materials used and sort of that raw design. The idea is that it's never been meant to be something proprietary to Gardner. So the hope and the dream behind it has always been that it's something able to be duplicated and repeated by others, and then sustainable. So really, in the spirit of that, we've we've looked at that original design and concept. We found ways to really streamline in certain ways, make more effective the cost of that design, so that it's cost effective and not cost prohibitive. But we've also looked at opportunities that perhaps are more feasible for, say, the general public, if you were, because it doesn't have to be only about construction either. But we look at our existing space, and we might have a small office that we know we'll have to, at some point repurpose or remodel, something to that effect, and we save it so that we do work around it. We preserve that space, at least in the form of its four walls, but we make it so that it's not simply a space that's whitewashed and meant to be demoed and reconstructed, but we outfit it with a well-appointed chair, a table, lamp, a mini fridge, maybe a rug, things that make it feel inviting and welcoming, a comfortable space, so that if someone chooses to use it, it's right in the heart of the construction site, but it's 100% intentionally designed for those purposes that we've outlined. We've had individuals go into those spaces and come out of those spaces early on thinking they might be judged, right? There might be a side eye or two. We've not experienced any of that. There may be some ribbing, if we're being perfectly honest and transparent, because guys are guys, right? If we speak in cliches, but every one of those guys too are understanding of what we're wanting to accomplish, and their understanding of the why behind it. And so that gives us a sort of consensus and a collective buy-in that makes these spaces kind of whatever we want them to be. And we're in a position now where we're able to take in the input and feedback we're getting from others and continue to improve on those spaces.
So as you think of your kind of broad, comprehensive approach to mental health and suicide prevention, both in the context of what you've done kind of in your initial area with these wellness pods, where is it you're going next as a company to make sure that focus on mental health and kind of mental fitness, if you will, mental health fitness, is that on the same par and perhaps maybe a little higher than even that focus on the physical part of that job?
Yeah, and I love that question. We've begun focusing on this year, and like a lot of things, it's hard. It's hard to figure out how to really put into action all the words that we feel so passionate in speaking. But as I envision it, as a company, a general contractor, specifically through our partnerships with various trade partners, design partners, and others, we have an opportunity to really get outside of our four walls, whether it be our office or our job sites, and look for opportunity to enter into others' spaces, environments different than our own, and really sort of share our passion. Our message, I believe, is the same as anyone else's. It's something we all want. I think we all want to live in a world where mental health is made a priority. It may be challenging to come by, and it may be more challenging in certain industries than it is others, but I think that's something that really empowers us at Gardner to sort of carry that torch and to maybe be the front line to serve that initiative, and ultimately that goal and vision. So whether we put ourselves in front of trade partners or other GCs and just share what it is we're looking to do, it's really about partnering, and through those partnerships, the empowerment that we gain by that. But it has to be about action. We talk a lot today about what that must look like. We feel that there's been a lot of talk, and talk has been good because at least we're doing that much. But there's so much more that needs to be done, and it has to be in the form of action. And it doesn't have to be so that we sacrifice our day jobs In fact, I think the two are married together, one and the same.
Yeah. So none of these kind of initiatives move forward unless you've got buy-in, obviously, on your rank and file and kind of the folks on the front line. They don't happen unless the supervisors, right, are all in on this, and they most certainly don't happen if the senior leadership team, which controls the purse strings and the resources, isn't all in on this. So, in the context of what came first, chicken and the egg, or the cart and the horse, and
Yeah.
where did this kind of all of this kind of originate from?
Yeah, I think I think the conversations all started before COVID. Certainly, if we were to look at a historical timeline, but I think really it was COVID, the pandemic, and a lot of what we all found ourselves in together that really generated a palpable need to really embrace this and do something with it. Lest we all sort of suffer more and more by it. And so rather than allowing ourselves to, I guess, be victim to what our circumstances were globally at that point in time, we looked at where we are locally and tried to really frame for ourselves in our minds what we can do. And so we just really sort of called a spade a spade. We addressed the elephant in the room. And, starting with Bob Gardner, we just expressed, and in settings just like this, how we're doing, how we're feeling, where certain things are impacting us and in what ways, so that we're not only relating to one another, but we're able to really kind of share within that space those emotions and those struggles. The important thing is that we always engage in real talk. That's a big part of what we mean by humanizing safety. If we're not willing to talk to you in a real way, if it's hard, we're going to tell you it's hard, but we are going to try to get it done, rather than just tell you we'll get it done, which isn't at all the truth. There's difficulty and struggle in that journey. As long as we own that, and we own that transparently, and we give others or allow others visibility into what we're doing and where we fail, by the way, then I think it empowers us all to do this together. And that's where it started, and that's where we are today, with buy-in, with support, and with backing, and with a sense of trust in what we're trying to accomplish.
Yeah. None of these things happen unless there's a cheerleader and someone driving that. Initiatives are great, but initiatives have got to have, it's a leader without followers, just a guy out taking a walk. And so obviously you've been the heart and soul of this. I know that you would share that credit with your colleagues and coworkers, but
Yeah, 100%.
These kind of things don't happen unless there's somebody willing to take the lead and push for that. So we have, as I said, Jen Owens and I have been impressed with the work that you and your colleagues have been doing at Gardner. It's helping to lead the way in an industry that needs leaders that are going to be out there and be willing to take some risks, be innovative, take on some challenges. At the end of each of these conversations this week, we're trying to kind of share with people as we close, because as I said, this half hour is going to go fast, and it went fast, is kind of give a message of hope. And so as you look at the work that you're doing with Gardner, as you're looking at the work that you do in this industry, what might be a powerful message of hope that you'd want to share with your peers and others that are in this space?
Yeah, thank you for that. I really just want to encourage everyone to actively participate in the process. Be willing to show up and be present in the moment. Speak up, ask questions, trust in the fact that there are many, many, many others who share in whatever sentiment it is that you carry, no matter how deeply buried that sentiment may be in you. I encourage folks to just let it out, even if it's a little bit at a time, and see where it goes. There are folks who are receptive and really just waiting to be heard and to be that somebody for someone else too.
Yeah. Good words, my friend. Brett, thank you for all the work that you're doing and the leadership you're doing it with. We're grateful for this opportunity to share that work with others. I know that we will continue to talk and look for ways to collaborate and partner with you and amplify the important work that you're doing with Gardner.
Thank you, Eric. I appreciate it.
Have a great day.
Thanks all. You too.
Bye-bye.